Claudio Cerchione, Istituto Romagnolo per lo studio e la cura dei tumori di Amadori, Meldola, Italy. I think it's really important to think about the idea of preventing multiple myeloma. And I think that this is a hematological disease in which the prevention program should be really effective, particularly starting from a correct differential diagnosis between MGUS and smoldering myeloma, particularly going to discriminate who are the high-risk patients in order to solve to the eternal question who is the patient who should be treated in the pre-myeloma status. And particularly we are going to perform in my institution a correct evaluation of all monoclonal gammopathies that came in our referral point. And I think that it's really important to focus about how is concretely today defined high-risk smoldering myeloma. 2020, according to PETEMA studies, according to Marimi Matteo's databases, 20 are the plasma cells in bone marrow, 20 are the free light chain ratio, and 20 is the M spike, the monoclonal component that we have to evaluate. If the patient has at least 2 of these 20, maybe should undergo, in my perspective, absolutely should undergo 2 treatment programs, and we have many ongoing clinical trials going to evaluate all the new immunotherapies, monoclonal and bispecific antibodies, in order to say, also a long-term approach, that considering the potential evolution of 60% in 2 years of high-risk smoldering myeloma, the answer to should we treat this patient, in my opinion, is absolutely yes, and we should make this therapeutic program, these clinical trials, democratic for every patient, because in Europe in this moment, unfortunately, we don't have any drug reimbursed and approved, even if lenalidomide has changed the history of these patients. Preventing is better than treat the patient, and if we are able to prevent as many patients as possible, we can start to treat the patient and eradicate the clone before then they get ill. And treating before they get ill means to avoid bone disease, to avoid renal failure, to avoid anemia, and to avoid all myeloma-related events. And this is what I'm trying to do with my institution every day, in order to also aware the population about the importance of deeply understand which is the status of the monoclonal gammopathy of no significance. In this way, we can optimize the treatment and we can optimize also their long-term outcomes. Thank you for your attention.